Hello everyone, and welcome. In this short lecture, we are going to explore what happens inside an emergency department, often called the ED or ER. Before you visit for work experience, it is completely normal to feel excited, nervous, or unsure about what you might see. The ED can look busy, noisy, and fast-moving, but it is also very organized. Today, we will learn how patients move through the department, who works there, what each person does, and most importantly, how you can observe safely and professionally. Think about this as your first guide to understanding emergency care from the inside. By the end of this session, you should be able to answer 3 questions. 1. What happens when a patient arrives in the ED? We will follow the journey from arrival, triage, assessment, tests, treatment, and what happens next. 2. Who works in the ED? You will meet nurses, doctors, nursing aides, porters, security, reception staff, and ambulance crews. Every role matters. 3. Why are some patients seen first? This is called triage. It helps staff treat the sickest patients first. Quick question. If one patient has a sore ankle and another is struggling to breathe, who should be seen first? Exactly, the patient with breathing difficulty. As a student, your role is simple. Observe, listen, ask respectfully, stay with your supervisor, and protect privacy. Before we start, think. What comes to mind when you hear emergency department? By the end, you will see that the ED is busy but organized and built on teamwork. This slide shows 2 students being welcomed by ED nurses. Imagine this is your first few minutes in the emergency department. You arrive, you wear your ID badge, and the team explains where you can go, what you can watch, and which areas are restricted. Here is your first key message. You are here to learn, but patient safety always comes first. The ED team includes people from many different backgrounds and roles. You may meet nurses, doctors, nursing aides, porters, security staff, ambulance crews, and reception staff. Everyone has a job, and everyone helps keep patients safe. Quick question. What do you think is the most important thing to do when you first arrive? The answer is simple. Be polite, introduce yourself, listen carefully, and stay with your supervisor. A good introduction could be, "Hello, my name is Fatima. I'm here for work experience. Thank you for allowing me to observe." That small introduction shows respect and helps staff know who you are. This slide shows the general flow of the ED. Patients may arrive by walking in, by car, or by ambulance. They usually pass through reception, triage, waiting, assessment, investigations, treatment, and then either go home, stay for observation, or are admitted to hospital. The ED is not simply first come, first served. It works by urgency. A patient with a serious breathing problem or chest pain may be seen before someone who arrived earlier with a minor injury. Pause and think, why might someone who arrived later be seen first? The answer is because the ED treats the sickest patients first. That is the key idea behind triage. Here we see a patient arriving by ambulance. When an ambulance arrives, the paramedics bring the patient to the ED and hand over important information to the hospital team. This handover may include what happened, the patient's symptoms, vital signs, treatment already given, and any concerns. The nurse and doctor listen carefully because this information helps them decide what to do next. As a student, you may be allowed to observe this from a safe distance. Watch how the team communicates. Notice how short, clear information helps the ED team prepare quickly. Ask yourself, what information would staff need before treating this patient? Look at the image. What do you notice first? The patient is on a stretcher, wearing oxygen, and the team is checking the monitor. Key point: fast does not mean panic. ED staff move quickly, but they stay calm and organised. Pause and spot the teamwork. Who is checking the patient? Who is looking at the monitor? Who is preparing equipment? Everyone has a role. As a student, step back, stay quiet, watch carefully. Do not block the team. Quick question. If the team is moving the patient quickly, where should you stand? Answer: beside your supervisor, away from the path. Good teamwork means clear roles, calm communication, patient first. Triage means deciding who needs help first. The triage nurse asks questions and checks: pulse, blood pressure, temperature, breathing, and oxygen level. Look at the colours. Red equals very urgent, yellow equals urgent, green equals less urgent. Quick question. A patient with an ankle injury arrives before a patient struggling to breathe. Who should be seen first? Answer: the patient struggling to breathe. Key message: the ED is not first come, first served. It is sickest first. Not every ED patient looks very unwell. Some patients can walk in but still need help. They may feel weak, dizzy, in pain, anxious, or unsteady. Look at the image. Who is supporting the patient? Who is approaching to assess them? Relatives can help by explaining what happened and supporting the patient. As a student, notice how staff treat every patient with respect and dignity, even if the problem does not look dramatic. Quick question. Can someone look stable but still be seriously unwell? Yes, some serious problems can look mild at first. Key message: do not judge by appearance. Assess carefully. This slide shows the central workstation, sometimes called the hub of the ED. Look at the image. What are the staff doing? They are checking computers, reviewing results, updating patient records, answering calls, and planning care. The screens may show patient lists, blood results, X-ray or CT requests, vital signs, and treatment plans. Around the workstation are patient cubicles. Staff move between the desk and the bedside all the time. Quick question. How do staff keep track of many patients at once? They use teamwork, communication, computer systems, and regular updates. Key message: emergency care is not just procedures. It is organisation, communication, and teamwork. This is the central workstation, the team's command centre. Nurses and doctors huddle here to update each other on how each patient is doing. It's quick, it's face-to-face, and it keeps everyone in the loop. Why does that matter? Because tracking patient progress in real time helps the team. Catch changes early, stay coordinated, make better decisions, together. Bottom line, good communication isn't just nice to have, It's what makes great care happen. This slide introduces the ED team. The nurse checks patients, monitors vital signs, gives care, gives medication, and updates the team. The nursing aide helps with comfort, basic care, and moving patients safely. The porter helps transport patients to X-ray, CT, wards, or other areas. Security helps keep patients, visitors, and staff safe. The doctor assesses illness or injury, orders tests, gives treatment, and plans the next steps. The big message is, every role matters. Emergency care only works when all these people work together. This slide gives you the best ways to learn safely in the ED. During your visit, observe the patient journey. Watch triage. Notice teamwork. Ask questions at the right time. Stay with your supervisor. Respect privacy. Take simple learning notes. But remember, do not write patient names or personal details. Your notes should be about learning. For example, today I saw how triage works. I noticed nurses check patients again and again. I learned that porters help patients move safely. I want to ask how staff communicate in emergencies. Quick question. What is one thing you would like to learn during your ED visit? Key message. Be curious, be respectful, and learn from the team. This slide is very important. Please pay attention. Do not interrupt emergencies. Do not touch equipment. Do not take photos or videos. Do not share patient information. Do not enter restricted areas. Do not stand in the way. The ED is a real clinical environment, not a classroom simulation. Patients may be frightened, embarrassed, in pain, or seriously unwell. They deserve privacy and respect. A simple rule is, if you are unsure, ask your supervisor first. And remember, no photos, no names, no social media. This slide gives you safe questions to ask during your ED visit. These questions are good because they help you learn without asking about private patient details. You could ask, what is triage? How do you know who needs urgent care? What does each team member do? How do staff communicate during emergencies? What skills are important in the ED? But timing matters. Do not interrupt staff during emergencies, patient care, or family discussions. A good phrase is, when you have a moment, can I ask you a question? Quick question. Why is this better than interrupting straight away? Because it shows respect for the patient, the staff, and the situation. Key message. Ask respectfully. Listen carefully. Learn from the team. All right, let's hit pause and put ourselves to the test. Don't worry, this isn't an exam, just a pulse check to see what's sticking. Ready? Let's dive in. Question 1. Triage test. 2 patients roll in at the same time. One with crushing chest pain, one with a twisted ankle. Who gets seen first? Pause and decide. Question 2. Stroke spotting. You suspect a stroke. What does FAST stand for? Question 3. ECG. Clues. Chest pain shows up, and we grab an ECG. Why? What are we looking for? Take a guess before you move on. Question 4. Rate spike. A patient's heart is racing. What could be driving it up? Name as many reasons as you can. Heads up, all the correct answers are waiting for you in the student handout. link in the description and pinned in the comments. So pause, think, then check your work. Let's see what you've got. Let's bring everything together. The ED is busy but organised. Triage means the sickest patients are seen first. Every team member has an important role. Your job is to observe, listen, and ask respectful questions. Stay with your supervisor and follow instructions. Respect privacy. No photos, no names, and no social media. If you remember only one sentence, remember this: observe safely, respect privacy, learn from the team. That is the best mindset for ED work experience. Thanks for joining us. That wraps up our intro to the emergency department. We hope you're leaving with more prep, more confidence, and a clearer picture of what to expect. One request: share this with other students. Let's grow the knowledge together. And don't forget, grab the student handout, link in the description and pinned in the comments. It's got quick summaries, practice questions, and a chance to test yourself. Thanks again, and see you in the ED.